Moses Keegan.
One of the most interesting things that this new model of medical ministry, by giving staff ownership of their labor, giving staff the management of their hospital, has shown is that a hospital for the poor need not be a poor hospital. We have been able, with a lot of hard work, to give competent care at very, very affordable rates.
This hospital, the way it runs is provision of health services through a Christian model. So we are using the Christian model in provision of quality but affordable health care to patients across the board, from people who can afford those services to many who can't afford them.
Now, the difference between St. Mary's and other hospitals is we are not looking at making big profits out of the institution, because this is a non-profit making institution. What we generate from our daily income from our customers is what keeps us going.
By the high volume of patients we serve, we're able to spread the normal running costs of the institution out over a wide range of patients. And so most patients pay very, very little for their care. We do things in a way that's sensible but competent.
And so the philosophy is very simple, that we offer good quality, affordable healthcare, which in itself has attracted a big volume of patients.
What we are charging is so minimal, enough at least for everybody else to afford service at St. Mary's.
Now, paradoxically, by keeping our costs down, we've attracted more and more people, as a result of which our surgeons, our internal medicine staff, maternity staff have become extremely competent and extremely experienced just because of the sheer volume of cases they attend each day. The teamwork is polished because of the high volumes. And so, although St. Mary's is targeting lower income persons, we've been able to provide superb, sterling medical care as a result.
When I came here, the kind of care I got was so superb, I could not even believe it. And every time anybody says he's feeling not good, I refer them to this place.
I was received fantastic. And I have so many friends whom I have come with them here, and they are very happy with the hospital.
Basically in St. Mary's, what we do, we concentrate to making sure that we offer quality healthcare or dental services to people at a very affordable price. So it's really satisfying to see that most people who are not able to afford, because dental care is quite costly, so we find that we get a lot of people who are not able to afford the services in like private clinics coming in here, and it's really satisfying to see because we get to see quite a number of patients who come in sometimes in pain and they leave smiling, which is really satisfying for us as St. Mary's and myself as a dentist.
We don't put any boundary between a patient and the worker here, because when each and every patient who comes to us, we have to appreciate them in the first place. Appreciation is the first thing, very important.
You see, we serve people with the dignity at a low price. When you serve one patient very well, you know, that patient goes tells another 10 people outside there. And those 10 people will also spread the good news to other 10 people. So you can see the impact of serving one patient.
It gives patients dignity to be able to afford the quality care that they receive at St. Mary's, and that's satisfying to us.
Right now, as we are speaking, the hospital is self-sustained. We don't go looking for money from donors to fund for drugs or that. The hospital gets enough money to pay salaries, to pay for the drugs, and to pay for other services without going into donor money.
St. Mary's, throughout its operational systems, is self-sufficient in its daily running costs, and that, I believe, is crucially important. If we're going to be self-maintaining, self-sufficient, it puts us in a position of vulnerability to the lower income people whom we serve, to make sure we stay affordable, to make sure that we are relevant to the people whom we aim to serve.
Basically, what we came out to do, which I think we have achieved, is to have the costs to remain affordable. So professionalism, providing quality health care at an affordable price.
St. Mary's is shaped by the needs of the low-income people whom we serve. One of the crying needs of lower-income persons was affordable, quality surgical care. And so very early on, the surgical department blossomed because there was such a massive need for affordable care. On a typical day in Nairobi, our team will operate on perhaps 45 patients in a day. This is a large number of major surgeries, and it's done in 3 operating rooms. So each operating room will have over 10 major surgeries done within it in a single day. And it shows the efficiency of our team in each room. The other thing it demonstrates, though, is when you're performing this many surgeries a day, that team becomes very experienced, very skilled at what they do. So paradoxically, the quality of care delivered is extremely high, extremely skilled, for very affordable charges.
The kind of patients, the caliber of patients we see here are the very poor patients. People who can hardly afford healthcare provision elsewhere, including even in government hospitals. So we see very poor patients and we provide them with the top quality healthcare.